So I'm just going to take just a few minutes to sort of take you through some of the big ideas that we hope to explore together today. And to start, why don't we all just take just a moment to think about what comes into our minds when we think about what leadership is in health and care. What images come up to us? And it might well be that for some of you at least, it's an image a little bit like this. So this is a boardroom from a big hospital, but it's where the leaders are, right? It's where the important things happen. And it's no accident that our brains often jump from leader to something along these lines. So I did an internet search, and the second definition that came up when I put in what is a leader was this. Quite a scary definition, actually. Person or thing that holds a dominant or superior position within its field. This is from a business dictionary online. So it's no surprise then with these deeply held beliefs about what leadership is, that when we think about leadership, our tendency is to look upwards at the top of the pyramid. But what if leadership also looks like this? So this is one of the women's marches that have been happening all around the world. And through our work, and I think through the work that lots of you are engaged in, we see leadership here in social movements. We see leadership bubbling up from communities. We see leadership in frontline staff and driven by people with lived experience. Increasingly also, we see leadership catalysed by new technology. And it's these richer and more diverse forms of leadership that we're here together today to spend some more time thinking about, if you like, leadership beyond the boardroom. Because we think it's time to challenge that idea that leadership only exists at the top. And instead to remind ourselves really that leadership can happen anywhere and that everyone can be a leader with the right support and context. And if you're only somewhat convinced by that idea at the minute, I hope by the end of today you'll be fully convinced of it. So this idea of leadership that can happen anywhere and by anyone is an important part, it's an important sort of frame, if you like, for the work that we do, and in particular for the work that we do through our people-powered results team. And that's all really about the idea of turning leadership on its head. In particular, our people-powered results team run what we call 100-day challenges. And we've run these all across the country, across the health and care system. And in fact, this year is the 5th anniversary of our very first 100-day challenge that happened in Essex. So today is also a chance for us to share our experience of running these 100-day challenges with all of you. So what is a 100-day challenge? What happens? So what we do is we join a local area and we help that local area to pull together a whole set of teams. And in those teams, there could be a community nurse, a social worker, a GP, somebody from the voluntary sector, somebody with lived experience, and a hospital doctor, and they can all form part of a single team. So they might normally work in different organisations, but they're brought together for 100 days, and we support them to set themselves a goal that they want to work together to achieve over the next 100 days, and they use data to track their progress against that goal. And importantly, these frontline teams are supported by local senior managers at the chief exec level or senior officer level, and their job is to give these guys a permission to try new stuff out, to create new ways of doing things, and also they commit that if these teams come across something during the 100 days that gets in the way, some kind of obstacle, that those sort of senior managers will pledge to try and sort that out for them. So what I'm going to do is give you a couple of examples from our 100-day challenge work that I think illustrates this idea of turning leadership on its head. And the first example is of a nurse called Rachel. And Rachel was in a team like this in Stockport. the challenge that we ran in Stockport. And Rachel is a nurse, a specialist nurse, who specialises in inflammatory bowel disease, which is known as IBD. And what happened was there was a team brought together like this, and they were all going to be focused on IBD and trying to improve the outcomes for people with inflammatory bowel disease. And on the first kick-off day, the consultant and the business manager from the IBD side of things went to the event, went to this meeting, and left Rachel because they didn't think she needed to be there. By halfway through the first day, they were beginning to kind of grapple with, well, how are people with inflammatory bowel disease currently served by the system, and what could we do differently? And they suddenly realised that actually it might be a good idea if Rachel was with them. So they gave her a call, she jumped in her car and drove across to the meeting and got stuck in. And because she was a person delivering these services and triaging everybody, she obviously had a fantastic point of view and set of expertise to bring to that conversation. So by the end of that event, that kick-off event, they'd come up as a team with a plan for what they were going to do over the next 100 days. And remarkably, within 3 weeks of that meeting, Rachel had not just planned, but set up a new rapid access clinic for people with IBD. So prior to that, people were actually having to wait about 35 weeks to get referred in and seen by a specialist. That reduced down to 9 weeks within that 3-week period of time. And also, impressively, there'd sort of been a bit of a talk about doing something along these lines for about the past 4 years prior to that. And Rachel made it happen within 3 weeks, once she was given the permission and the support and was invited in to do that work. And that's backed up by a poll that we've just run with the Nursing Times that was responded to by over 300 frontline workers, most of them nurses. And through those respondents, less than 1 in 5 of them think that the health and care system acts on the ideas from frontline staff. Less than 1 in 5. If you compare that to nearly 90% of the respondents said that they have an idea for how to improve the service that they're working in. So that is just an enormous missed opportunity. But as we can see, with the right context, Rachel could step into that position of leadership. So that's the first example. The second example is of Callum. So Callum is on the left here. He's a trainee gardener and he has learning disabilities. And on the right is his care assistant, John. And Callum got involved in one of our 100-day challenges that we've been running in Canvey Island in Essex. And that 100-day challenge was all focused on how the Essex health and care system can do better to support people with learning disabilities and autism. Roughly spending about £200 million a year at the minute on support and services for people with learning disabilities and autism, and knowing that there's much more to be done to enable people like Callum to live meaningful and fulfilling lives. So this time it was Callum joining one of these frontline teams. And as a team member, he had all of his direct experience of using services to bring to that conversation. And in fact, in the run-up to the 100-day challenge, he'd been spending most of the 5 days a week in a specialist day centre. But most of the other people in that day centre were in their 40s or 50s, and Callum was finding it, quite boring, a bit frustrating, really. So he brought that experience with him, and when there was discussions about, well, what should we do? How can we make it better for people with learning disabilities and autism? Callum's idea was actually not more services. Don't just tweak around with the current services. How about a cricket team? I'd love to join a cricket team, and I know some other people who would too. So with the team's support and with John's support, Callum started to write letters to people and went out and met people and talked about this idea of a cricket team and what we needed to do in order to make it happen. He also recruited new team members. So During the 100 days, the team was joined by somebody working in youth services and somebody from social care. So one of those people sourced some equipment and a team coach, and the other person wrote the consent form and the risk assessment. And within the 100-day challenge, a cricket team was born, and there is now a cricket team in Canvey Island. All of the members of it have learning disabilities or autism. In fact, they played their first match yesterday against the Canvey Island Cricket Club. And they've got an ongoing support from Active Essex. So it's going to be a weekly session at no additional cost to social services. And Callum himself is transformed in terms of his sense of what his potential is and his satisfaction of setting up this incredible cricket club. So that's our sort of second example. And if you want to find out more about how we run these 100-day challenges, then do pick up this booklet, which is available today. So do pick one up and take a look. And I also wanted to sort of share with you an idea that we find very helpful in our work with these 100-day challenges and more broadly. And it's an idea that comes from a professor at Harvard, Professor Ron Heifetz, who actually originally trained in medicine and then moved into sort of leadership more broadly. Some of you may have heard of him. And over 20, 30 years, he's spoken to hundreds and hundreds of leaders from across the world, leaders that have ranged from guerrilla fighters in war zones through to millionaire businessmen. And he has, one of his key ideas is something that I think is really helpful for us to bear in mind as we go through the day. And that's the idea that authority and leadership are two different things. And what we often do is put them together. So actually, for those of you who thought, when I asked you at the beginning, if your mind jumped to either your boss or your boss's boss or somebody in a boardroom like that, what your brain was doing was putting authority and leadership together. And oftentimes they do come together, and we want them to come together because we want our people in senior positions of authority with big senior jobs, running organizations, we want them to be leaders. So that is a good thing. But the breakthrough from Heifetz's work is it doesn't always have to be together. You can have authority without leadership, and you can have leadership without authority. So if we think back to our examples, so Rachel, the specialist nurse, had an authority position. She was a specialist nurse. But the way in which she was constrained within that authority position meant that really she wasn't enabled to be a leader in that role. In fact, she said that that was the first time in over 20 years of being a nurse that she was genuinely listened to and involved in how the service should be run. So she had authority, but until the 100-day challenge, she really wasn't enabled to be a leader. Equally, if you think about Callum wasn't part of that team because he had a big senior job or a big job description. He was there as a citizen, and he led a whole new approach to people with learning disabilities and autism. His authority, to the extent to which he had any, was informal authority from his lived experience. And if you think about what really makes a leader, so if we junk that businessdictionary.com definition that I shared with you at the beginning, if we junk that and really think about really what makes a leader, it's somebody that has a vision of something and that works with other people and mobilizes those other people in order to achieve that vision. And under that definition, both Rachel and Callum are absolutely leaders. And so that's what we mean by when we say that everybody can be a leader with the right support and context. That's what we mean by it. It's just a question of unlocking that potential. So my final thought is the connection between all of that and innovation, because we think the idea of turning leadership on its head is vital for innovation. Because we know for innovation what we need is new ways of thinking and challenging how we do things, mixing stuff up, shaking it down, challenging rules, making new rules. And all of that work needs new perspectives. It needs perspectives from people like Rachel and Callum, and indeed from all of you. And so we hope that today will remind you, as you go forward, when you hear the word leader, you don't automatically look up but you look all around you and that you're also, I hope, fired up with your own sense of potential for even more leadership. I'm delighted to welcome staff from the East London Foundation Trust who are going to share some of their thoughts about leadership in their own particular style. So I'm delighted to hand over to Paul Galuli, who's Chief Medical Officer from the East London Foundation Trust. Thank you, Paul.
Thank you, Halima. And thank you very much for inviting us along this morning. As Halima says, my name is Dr. Paul Galuli. I'm Consultant Forensic Psychiatrist and Chief Medical Officer at ELFT, or East London Foundation Trust. ELFT provide mental health services for the 3 London boroughs of Newham, Hackney and Tower Hamlets, as well as mental health services in Bedfordshire and in Luton. We also provide community health services in Newham, Tower Hamlets and Bedfordshire. About 7 years ago, we started off on our quality improvement journey to really improve the quality of care we supply for our patients and also to improve the quality of life for our staff. We engaged with IHI in the States and have been working over the past 7 years with our stakeholders to improve what we give to our communities. Part of that is who I'm going to introduce you to this morning. ELFT in One Voice are singers made up of service users and staff from across East London Foundation Trust. To date, they've performed on stage at the Barbican, at the East London Staff Award Ceremony in 2019, and also at ELFT Quality Improvement Conference. ELFT in One Voice are the latest in a line of exciting art-based ventures, bringing staff and service users together to celebrate the creativity and diversity of our organisation. At the Quality Conference, ELFT in One Voice performed a song specially composed around the theme of co-production, which featured elements of vocal improvisation. They were joined in the performance by rapper and medical student Mandeep Singh. A smaller group of the singers involved are here to present the song to you today.
A stethoscope in his left hand and a set of notes in his right. White shirt, beige trousers, black leather shoes bright. And the doctor begins his ward round. A small crowd forms round of healthcare professionals, all trying to serve a single cause. To ease a fellow human suffering and misfortune. To be the beacon of hope that a patient can go report to. So they move from bed to bed, from bay to bay, from case to case. Pressed for time, but spending night writing notes for longer than they conversate. Till they get to Mr. Patient, who'd been bedridden for 11 days. The doctor approached Mr. Patient and told him about the results from the ECG, the EEG, all that he'd seen up on DCT, did a screen for the DVT with the DPST, checked his skin for a BCC, got his FBC and the ITP, got his psyche checked in the ICD, did a screen for the ABG with the C with the PHP, and none of them, not a single investigation explained a thing. So, the team, when they did another 3 repeats, determined to figure out the disease, their evidence base hella big. They weren't gonna sit back and just see disease. They huff and puff and fund another couple dozen PhDs. They rummage through some publications, searching for what he may need. They prod and poke and push and pull to diagnose the problem, pumping isotopes inside this bloke to find out what's the problem. They publish case studies, great studies, qualitative and quantitative studies, UK and USA studies. They published 28 studies and none of them explained a thing. The doctor approached Mr. Patient and promised him he'd get care from the very most specialist of teams. Mr. Patient turns to him and says, "That's okay, but if you care for me, it's simple. Ask me what I need. Try to
see me as I am. Step into my world. I'll help you know me. I'll help you help me. See me as I am.
see me as the way that I really be.
Step into my world.
More than the notes, I am more than your
I'll help
disease.
you know
I'm a
me.
man, a son, a human
I'll
being.
help
Talk
you
to
help
me.
me.
Handle my story carefully, please.
I see you in circumstances complex and unique. I see you individually, a person right in front of me. Circumstances complex and unique. I see you individually, a person right in front of me. Circumstances complex and unique.
Right then. Nesta, let's guess what's coming next as we present a couple of sentences to try to digest the way that really we could figure out what leadership should be. Because leadership should be not something that be a rift between the difference that sits between what's you and me, but really conversate between two different human beings. But deep inside our DNA, I see that really we are one thread of a similar seam. But it seems to me that I forget that sometimes, that I forget that there's similar between dark and what is sunshine. Sometimes your story flies over my head. Sometimes I hear your story and I feel some kind of dread inside of my soul, inside of my spirit, inside of my lyrics, inside of my... Whatever it is that a patient should be given. See, there's a rift, there's a difference, and I'm trying to overcome it. But I can't really do it. I feel like I am one of comets and so are you. So am I. So is truth. Do or die. Why is that? I don't know, but sometimes patients think about, never want to go there. No. Let's bring it back. Bring it back to the basics. Bring it back to conversation and human being relating. Like, there's similarity in you and me. Deep in my DNA, the tapestry of human beings. Let's get back to the conversation, reflect on contemplation, and then deal with this over the nation. Let's bring it back to the basics, to the basic blocks that build up where we might just try to watch the clock. 24 hours, what are we heading for? Maybe I don't know. Maybe I need to reflect and write my notes in the dojo. Sit back and watch, listen to what I feel, to what you feel, because what I feel is so connected to what you feel. And if I reveal what you reveal, as we do conversate, then you realize that I am more than just a broken face. I'm real, like you. I skin, I bleed, I breathe, I sleep, I dream too. A human being, patient, you are not diseased. You beat like a brother, a mother, cousin or uncle. If I don't listen to you, then my professionalism is untrue.
We meet in a conversation of co-creation and collaboration. We're growing in understanding, we're getting better, our heads together. We meet in a conversation of co-creation and collaboration. We're growing in understanding, we're getting better, our heads together. We meet in a conversation of co-creation and collaboration. We're growing in understanding, we're getting better, our heads together. We meet in a conversation of co-creation and collaboration. We're growing in understanding, we're getting better, our heads together. We meet in a conversation of co-creation and collaboration. We're growing in understanding, we're getting better, our heads together. We meet in a conversation of co-creation and collaboration.